and welcome back. It's another episode, Ask Your Gyno series. I'm your host, Faith Ngami, and we are on studio. Tuko set, daktari yako. And today we also have a friend who is also a registered nurse and a lactation consultant. And we are here with very important notes for you. Be ready to learn and learn whatever you have to. Listen well, ask your questions. Breastfeeding is here. Tuko na nyinyi kina mama. Karibuni studio.
Thank you.
You will introduce yourselves.
Yes.
Together with our friend and nurse. Karibu.
Thank you so much, Faith. It's been a while.
Hey, it's Karana.
Should we say Happy New Year?
Happy New Year.
Karibu sana. So Dr. Karanja is my name. As usual, I'm here to answer all your questions. I'm an obstetrician, gynecologist, but today is not my day. We have a specialist, lactation specialist, who will be here to discuss with us matters to do with breastfeeding, and I'll be chipping in the obstetric part. So I'll allow her as well to introduce herself, then we can proceed.
Okay. Thank you, Faith. Thank you, Daktari.
Karibu.
It's a pleasure being here with all of you today. My name is Okla Jepkorir. I'm a registered nurse. And as she mentioned, I'm also a lactation specialist. So anything breastfeeding mothers, ask me. So let's roll it today and also be ready to learn.
Karibu sana Okla.
Yes,
We are happy to have you. We've walked with Dr. Karanja. Tumetembea na yeye, ametupeleka Gyna, Ask Your Gyno, tunamuuliza maswali. And sasa tumefika, we've carried the pregnancy, tumefika, we've delivered. Now from there, tunaendelea aje?
Tunaanza kunyonya. Yes. Yes.
Tunaanza kunyonyesha saa ngapi?
Immediately after delivery, a mother should be able to latch the baby and breastfeed. So if anything that maybe medical doctors or the nurses need to ascertain, maybe immediately after a mother delivers, is we give them a window of at least 1 hour to be able to have latched that baby on the mother's breasts. Yeah.
So why is it important to breastfeed?
Breast milk is available. You know, it is there. It is on the mother. So it is the work of the baby to just suckle, get a good latch, and be able to breastfeed. Another thing is breast milk. It is customized according to the baby's age.
Okay.
So where you get, if this baby is 1 day old, the milk that is produced is for that baby of 1 day. So as the baby progresses, the calories and the nutrients are designed to the age of the baby. So breast milk is designed that way, so that it's special. That's why we encourage breastfeeding. It is also a bonding way for the mother and the baby. You know, you get to bond. It suits the mother. It also heals the mother. It's not only to the baby. It also helps in mother's recovery. You know, our uterus tend to overstretch.
Yeah.
Breastfeeding helps to contract the uterus and get it back to its normal size. It helps the mother with the hormones, the oxytocin hormone, which is responsible for the healing of the uterus. Okay. It is cheap. You don't buy breast milk.
That is true.
Yes. It's cheap. You don't need to buy breast milk. The baby has to just suck it out of the mother and be full. You know, like it's readily available in the correct temperatures. It is sterile. It is easily digestible for the baby. Yeah, so breastfeeding is as important as it is.
I didn't know about that part, about the custom milk. That breast milk actually comes like it's custom for the particular time.
Yes.
I didn't know about that. Sijui kama nyinyi mlijua.
Now you know.
Now you know.
Now you know probably.
And I think the other benefit also to the baby is that breast milk contains antibodies and also white blood cells. So in terms of infection, if you compare babies who are breastfed and those who are on formula, breastfed babies, their immunity is better and they have less infections because it contains natural antibodies. So that is a benefit as well. And also for brain development, there's a slight difference. But of course, there are many other factors that determine a baby's brain development. Now, to the mother, oxytocin is very, very important in terms of bonding.
Yes.
So once the mother delivers, like what you had asked the first question, once the mother delivers, we'll prefer the mother to breastfeed almost immediate. After delivery, you place the baby, then the mother starts to breastfeed. That is what we would prefer. But there are those instances when if a baby comes out and the baby is not okay, there's a way we score the baby. Your baby needs to almost cry immediately. Your baby needs to be pink. So if you think the baby is not okay, you don't waste a lot of time trying to breastfeed the baby because you'll cause more problems. So you try and resuscitate the baby before now you bring the baby to the mother. So those are some of the instances where it might take more than an hour before you bring the baby to the mother. The other reason could be in case there's a complication with the mother. Let's say after delivery and the mother bleeds a lot. So there's a lot of action when there's severe bleeding. So we don't want the mother to be breastfeeding and you're trying to tell her turn this way so that we can do 1, 2, 3. So you look at all the circumstances available at that time. But the best, as she had said, within 1 hour, that baby should be breastfeeding. Yes.
So what happens when the mother is trying to breastfeed na haitoki? Because I think there are times whereby you're literally struggling
to yes.
Okay. What happens at that time?
So a good latch. It depends with the technique you have to learn. The mother has to learn with the baby on latching. Latching is how you bring this baby to the breast. So when the baby gets to swallow the nipple completely and grasp this breast, they're able to initiate the suckling. The suckling is what helps the mother, it sends the signal to the brain. So the brain has 2 hormones that it has to release. It has prolactin and the oxytocin. That's why mothers could be feeling cramping when they are breastfeeding. So this prolactin signals the breast that, you need to release milk. Because actually, breast milk is already there. Even during pregnancy. It starts to form around 17 weeks.
Okay.
So it just needs this suckling reflex for it to signal the brain that, release this, it's time. So patience is another thing, as a mother, because another thing is if the mother's brain is not settled, this mother is a bit disturbed, like Dr. said, around pain, around procedures. You're not able to make breastfeeding successful. So you need to make sure that the mother is comfortable and they're in a position where they can breastfeed. Okay. Yeah, so with the time also those release of hormones will come. And the first suckling of the baby, the colostrum is what the baby gets out of the mother as the first. Colostrum is very thick. It could be clear, it could be in orange color. But that is important. It's the first baby's immunization. It can last the baby for quite a while because it is very sugary. So this baby needs to get this colostrum because it's not much. The baby's tummy actually is very small.
Yeah.
I have these beads here. This is the baby's tummy when they are born. So this baby doesn't need like a whole cup of milk to be full. No. The 10 mils from each breast is enough to make this baby full.
Okay.
So that colostrum will last them as much. And then now, the milk transitions. It goes to a transitional milk after that day, maybe like 48 hours to 72 hours. And then now the mature milk comes later after the 72 hours. So this is actually the baby's tummy as they grow. So yeah, as it progresses. So by 2 weeks, they're here. That is when you also see the colors I have here. Dark green is when they start getting born. Go to a light green one. And then the baby now starts having poop that is yellow.
The yellow one.
Yes, maybe after 5 days. So you don't really need a lot for a baby to imagine that this baby needs to really be full, to really feed. Yeah.
You know, in the African setup, we are used to akule ashibe.
Now you know.
Now I know.
You can imagine
No?
the sizes.
I can imagine how many mothers out there they really struggle to give the baby as much milk as possible. I struggle to give as much milk because I'm like, Adashimba. You know, I didn't know that. Just
It's a tiny.
Yeah, it's tiny.
Because you're imagining it's your tummy.
Yeah,
You're not imagining it is the baby tummy.
like, it's the baby, but I'm not trying to imagine that tiny. And now the poop color, why is it green and yet the milk is white or yellow? Actually, like with the first.
Usually with you see what she's showing, the green and the yellow, it's more of what the baby is consuming.
Okay.
Because the green one, the baby can even poop even before delivery. I'm sure you've heard of meconium. Yeah. We had those lessons when you're pregnant. So the green part is what is contained when the baby is in the womb. It's not what the baby has consumed. So after a few days, that's when now the baby transitions to the yellow. So it's more of the ingredients that are taken in, processed by the intestine, then comes out different. Yes, that's why the changes in the color. Yes,
I know.
No,
you know. So what are the different breastfeeding positions? Because we have people who deliver vaginally, or what we call the normal delivery, and we now have the cesarean section, CS, and they're having a wound, and we're used to breastfeeding is this way. Yeah, so now I have a wound, and I'm supposed to put it at a new visa. So how do I handle this?
So, this way is commonly the cradle position.
Yeah.
This position is called cradle. For a vaginal birth, they are not restricted to any kind of position. So it should be the comfort of the mother and the baby and the technique they've learned on a good latch, you know. So for vaginal, we will not restrict them to any, but for the cesarean section mothers, we are trying to avoid any strain on the abdomen because this is where the incision has happened. You don't want the baby kicking. And another thing is we are focusing on the comfort of the mother. Because this brain is what needs to release these hormones that we need to feed the baby, okay? So I will recommend, this baby, there's a football position where you put the baby underarm, and this baby is able to assess the breast on this side. So we've avoided the abdominal cavity. There's a laid back position where a mother can just gently slide forward to a comfortable place and bring this baby here. So she's able to latch the baby, but we are avoiding here and she's in a comfortable position that will not strain as much. So, and then there's a cross cradle, but that is not for the cesarean section mothers. Cross cradle is where you bring this baby onto this breast, but you use the same hand next to the breast on the baby. Okay, so we are on the abdomen. Yeah. So that is a vaginal. And then there is side lying. Side lying is when a mother is on the bed lying, and then that mother is brought the baby from the side to breastfeed the breast that is next to the baby on the side. So that one will not strain the mother on the abdomen. So 3 positions for a mother, depending on the comfort that they get, on whatever position that they have achieved a good latch, that is what we will encourage. Yeah. But for a vaginal mother, you can explore every other position. Yes, as long as you get the correct latch, then we are good to go.
Still on the latching part, how is the baby supposed to latch? Because at times we have people who are well endowed up here, and they train to breastfeed, and the baby probably blocks the nose, and
They are blessed.
yeah, very blessed.
So for us who are very blessed, and we are risking covering this baby's nose, laid back is better. When you lay back, the muscles of the breast tend to either relax or move backwards. So you're able to access the nipple easily. Even the underarm is better because the nipple, could be central, but you'll be using your other hand to make sure that this baby, you're not covering what? The nose. Yeah.
It's very important because there are people who are doing so.
Yes.
Anashindwa shida
And everyone is trying to tell them, do this, do
Yes,
this.
do this,
Yes.
do this.
Yeah, it actually happens. Most, I think, new mothers, they go through so much.
Mm.
Wengine wanakwambia mshikilie hivi, mshikilie hivi, realize mui. Wanakwenda hii side nyingine, realize.
Like I said, it's a technique. You have to really learn as a mother with the baby as time goes by. Because also the nipples, not all of us have a normal nipple.
Yeah.
A normal nipple is always a nipple that is very pointed.
Okay.
Mm.
That is a normal one.
We call it common. Okay, let me not say normal. You
Normal.
having the other one is not abnormal. So it is a common nipple.
Yes.
Common nipple looks like that. It's very pointed.
Yeah.
Okay. Then we have a flat nipple.
Mm-hmm.
You see it is there, but it is not popping. And then there is an inverted nipple. Okay.
Okay.
So the challenge sometimes in latching is with the nipple also.
Mm-hmm. Yeah.
When you don't get a good latch, you get the nipple getting sore and it is cracked.
Yeah.
So sometimes you can just tickle it, or if yours is very inverted, sometimes it is challenging. So a nurse could guide you, or a lactation specialist, myself, if you're having a challenge, where we use some technique to just keep the nipple a bit protruding, because also this is what makes the baby latch.
Yeah.
So when we achieve also the nipple, this baby is able to swallow this.
Yeah.
So a good latch is when a baby swallows completely on this nipple.
Yeah.
And when they're breastfeeding, there is no sound. You can only hear the baby swallow. But if you hear these clicking sounds, no, that is not a good latch. So you need to break the latch. And breaking the latch is not pulling the baby away from the nipple. This baby grabs nipples. So they could even tear the mother by pulling away. And now, when you're breastfeeding, the nerves are very sensitive and the ends. So you want to break the latch by inserting a finger in between the gums of this baby. So just insert your finger gently and then make sure you separate the two gums. So you are trying to open the baby's mouth so that they let go of the nipple. And then you now latch again, where you aim on the roof, the nose of the baby. So let that nipple and the baby's nose come to touch. And then this baby will be able to extend their head, open wide their mouth, and swallow the nipple. But another thing you want to achieve is you need to be in tummy to tummy with the baby. The mother needs to be sat upright, comfortably, with their feet touching on the ground. But if this is a CS mother, of course, we have to explore the other positions in their comfortable positions. If the mother is not comfortable, aching on the back, we are still protecting that brain, because we want what? We want milk to come out with the release of the necessary hormones. Yeah. So a good latch is you bringing the baby to the breast and not the mother going to the baby, because you will strain your back, you will strain your shoulders, and that will bring other issues. It does. So you bring the baby, aim on the roof. So it is more, the lower chin flinches out. The lower one, you will find there is more on the areola. Areola is this part. So the lower lip is more on the areola, you'll say they've swallowed, and then the upper lip comes just gently there. So a proper swallow, because what we are avoiding is the nipple feeding that brings soreness and painful. And what we want to achieve with breastfeeding is the mother should be able to enjoy it and the baby too. So if we are not enjoying breastfeeding, then we are not able to achieve the goal of baby growth and protection and every other benefit. Yeah, and even milk supply. Because the more we latch the baby nicely and the circle reflex, the more we tell our brain, you know what? Keep bringing it. So supply inaendelea kuongezeka. Yeah.
There's something you mentioned that maybe should come out clearly, yeah? On how you take the baby out. You don't pull the baby.
Oh, about the detaching.
Yes, the detaching. Maybe just
cutting the circling.
Yes, just clarify on that.
Yeah, so when a baby latches poorly, that is how a baby grabs the breast. Yeah. You have to break it. So you need to break that circle by putting one of your fingers. You could either use your index or your small one, but small one because the baby is very tiny. So just root for the baby between the gums on the side. Go into the side of the baby's mouth. Place your finger there. And then try to open, because you're opening. Our target is to open in between the gums so that this baby lets go. Or you have a room of, taking the baby out of the breast, and then now you start a good latch again. So that is how you break a very poor as opposed to just pulling. Okay. When you pull, this baby grabs those nipples, so your nipple is going to be a string, and you'll not even know it. It is very elastic and painful.
Because there's a point, even as you're mentioning about the different of the nipples. I think we will come to it later. But I just love you clarify on how will I know I have a normal nipple, slightly flat, and an inverted one? Do I check even during my pregnancy? Am I supposed to check with my gyna? Or when I go for the clinic visits, am I to check and just confirm, do I have a normal nipple or a normal breast at the case of breastfeeding?
Yeah, I think nipple doesn't change even with pregnancy, just the pigmentation. It is already an anatomy, like on how it is there. It is how your breast looks like, even when you are a girl or before even pregnancy. Because what changes in pregnancy is just the color and the size. But the anatomy of it, you having a nipple, like myself, I know if kabaridi kipitia kidogo, it is pointed. So actually, so for common nipples, it's that way. So how they are normally. And then flat, you can feel it. It is there, but it's not protruding. And then now there is inverted where it's in. Nakaa ka pimple. Kama ni ka dimple. Ka dimple kameingia. Enye hata ukiekelea eyes hivi, bado haiko. Yes.
I think what Faith is trying to maybe to allude to is there a way you can prevent before you deliver? Yeah. So that, do you have a flat nipple or an inverted nipple before delivery? Yeah. And is there something you can do? Or you just have to wait for delivery, then you have now to correct it? I think that's what you're trying to...
Okay. We don't want to encourage when someone is still pregnant to do anything with activating the nipple. Because what we said is, when it will assume that the baby is already here, and this hormone called oxytocin will now start triggering what? Early labor. So we want to avoid it during pregnancy for this to happen. But you can liaise with your doctor on birth plan, or as a lactation specialist, I can also be able to discuss with you when you're having a challenge on what we will do so that we initiate this breastfeeding as early when you have delivered, if you're having a challenge with the type of nipple that you have. So it is not recommended before birth, before delivery, because we want to avoid preterm labor. Yes. I'm sure Dr. will agree with that.
Sure.
Yes.
Thank you for that. And so how frequently should I breastfeed my child?
You need to clock 8 to 12 times in 24 hours. So that means you have a window of every 2 hours to feed your child, or 3 hours to feed your child, for you to clock the 8 to 12 hours. I know people will be like, you know what, this baby sleeps a lot. There are things called cues for CUES, hunger cues. If the more you sit with your baby, the more you start understanding them, they could actually be awake this frequent of 2 hours or 3 hours. So there are babies who will wake at 2 hours, there are babies who will wake up at 3 hours. Naturally, they will do it. Yeah. But for the babies who sleep, you will find them, they are sleepy, but they have these hunger cues, which are signs that they could want to feed. They start moving, they start turning, maybe they're not crying. And you don't want to get the babies to hunger cues, because this is now a baby who's already triggered. They're very hungry. They want the breast like now. Yes, so we don't want this baby to get to that point, because even they can refuse to feed. And that is when we get cranky babies. So let's just schedule, if your baby is for 2 hourly, feed them that 2 hourly. If it's for 3 hourly, feed them 3 hourly, because that is their window. Their window, yeah.
And how do I know it's 2 hours? Is okay, with a mother with a newborn, you're trying to adjust. There's also this part you're being told rest, have some rest, and you have your child there. Then you need to feed your child in windows of 2 hours, 2 hours. So, any advice? There are two types of newborn mothers. There are those who are surrounded. In an African setup, your mother, you have probably your mother-in-law, you have your sister, like you're surrounded, they start communal. Then there is now the part where somebody is alone. You've delivered, you're now home, wewe na mtoto wako. And there's this part you need to rest, you also need to feed. So most of the time unaweza pata you're resting na knock out kupeleka.
You know, for us, mostly we will say 2-3 hours strictly. But in such circumstances, you know, you have to learn the technique. Ndo naambiwa pumzika na mtoto. Yeah?
Yes.
Mtoto akilala, it is also your time to sleep. Because both of you, when you learn that technique, you will start waking up also in that 2 hours. Yes. Because I don't want to say you bring that baby on the sideline and sleep with them so that you can just throw. But you see, if this mother is very asleep, utapata umefunika mtoto na nyonyo, and then we are having other medical issues. So rest when your baby is also resting. Because sometimes, you know, it's even like an hour up or a very 30-minute up. And a mother's conscience will not allow them like too deeply to go off. At some point, utashtuka upate hata labda ni 30 minutes umelala and you're thinking you slept for the whole 3 hours. Yeah.
So now to the case where you feel like mtoto amelala muda mrefu. You realize, ajamka, there are no cues, but
it's taking too long.
Yeah, it's been too long.
Amsha mtoto.
Mpaka mbako naangalia, watu tunapumua.
Amsha mtoto.
So
amsha mtoto food.
How do I
wake a baby up?
Because amelala, is there a technique? Probably there are those who say like start by tickling the feet. There are those ama kuna huyu ataenda tu chukua.
A baby ni human tu kama wewe. Siwe pia unasemanga niamshe polepole. So unataka pia kuamsha mtoto polepole. You just hold them, you can turn them around, talk to them. Yeah, tell them it's time to feed, you know, umelala sana. And then check their nappies, You can also exercise. With that, utapata mtoto anzaanza tu kuwa awake naturally.
When once you now start getting to the system,
Yeah.
talk to them, mwambie.
Ongelesha. Si hata gainas mnaambia mama, ongelesha mtoto
Ongelesha
akiwa kwa
mtoto.
tumbo.
Even when you're pregnant.
They're used to those voices. They're used to those voices. So even when you tell them that, yeah. So treat a baby like yourself.
Treat your baby like yourself.
They
need that affection.
Yes, they need it.
How do I know my baby has had enough milk?
You're breastfeeding the baby. How do you know this baby is feeding? Well, first we'll look at, there is a sign, milk drunk.
Yeah.
Na mtoto kujitoa kwa matiti.
Yeah.
Yeah.
Okay.
Another thing also, there is emptying of the breast. Your breast is very hard. And then after a while, you realize, this baby may suckle, imetoka, because those milk ducts, it just holds on the milk. So this baby activates that hormone. It opens in a empty. Mtoto kushiba, anapata hiyo drop, anaachilia mwenyewe away from the breast. Another thing also is the diaper.
Yeah.
After 5 days, first day, we are targeting one wet diaper maybe and one soiled of poop. So one poop, one wet one. So depending on the type of diapers you use. These days, kuna sijui kina Rascal, you can't even tell. You can tell, it's very dry. So depending on the diaper mama konayo, jua hiyo ni wet ama si wet. Of course, your poop utaona the poop, it's stained. So a day until after 5 days, you're targeting like 5 wet diapers and 5 poop. But there are other babies who will not actually be pooping these 5 times, 3 times, but you will find they are pooping a lot, maybe in a day or once in a day. So just make sure. Another thing is baby is fitting into these clothes. Ama wameanza kuacha nguo walikuwa wanavaa. So that is a baby who's at the weight, and that is a baby who's getting satisfied. That is a baby who's getting enough. Yeah.
So when I'm breastfeeding, because I have to believe also as they grow, they change their time. Probably maybe akiwa newborn alikuwa within 10 minutes amemaliza ameacha. As they grow, una realize anaenda 20 minutes, anaenda 30 minutes. Saa ingine unapata ameingia 40 minutes hajaachilia titi. Hivyo tu. Ukijaribu kulitoa unaona na silekamsi. Bado nimwache endelee ama tunaendelea kuna.
Because babies are feeding on demand. And your breast is going to also be full based on demand. And this is based on the latching times in the 8 to 12 hours. Yeah. So if you're latching your baby 8 hourly, whatever wanapata is according to what they want. But if you start breaking this chain, you are trying to tell the baby, what sihitaji hizi mingi. So mtoto the more anasako, empty, hata kama bado anataka kuendelea, make sure they empty this. And one secret is don't pull the baby away earlier from the breast. Ndio mwingine anaekelea kidogo hivi anaona imetosha.
Nimesinzia.
But also sometimes, how milk comes, especially the mature milk after 72 hours of delivery, inaanzanga maji. For those mothers who've done pumping, unaona maji kwanza, and then the next milk sasa ndo inaanza kubehave maziwa. So what if you're drawing this baby away when the actual meal is coming? So wacha abaki hapo asikuwa umefeed mtoto maji peke yake, because there is the hind milk yenye inakuja now that has the calories, has fats, has the proteins, has the correct nutrients and those antibodies that this baby needs. Yes. So wekelea mtoto kwa matiti.
anyonye tu.
Hata
Hata hiyo
anyonye.
usiku. Anyonye tu. Aendelee tu. Hata ukisinzia.
No, kuna sometimes, you know, they are not actually even feeding after wameshiba. They just want, they're just there. It's called pacing. Wako tu, wamejisahau, then kidogo kidogo. Wacha ninyonye. It is comfort for them also. That's why we're encouraging tummy to tummy with the baby, kwa sababu akiwa hapo pia anatulia, ana relax, unamsoothe. It is the gift we have as mothers to nurture these small ones.
And now, what in the US of, because I believe pia the breast milk haizifanani. Now in terms of, there are those who have, I'll say, probably an excess amount, overflow of milk, and there are those who have very little milk. How, because these two cannot feed the same. Huyu mwenye amejaa maziwa, huyu mwenye yake ni kidogo, cannot feed the same.
What do you mean cannot feed the same, like, in terms of?
Ile mwenye iko kidogo, though I still want to hold on to the fact that you're saying the milk is...
It is customized to the...
customized of the baby at that particular time. But still you have ile mwenye, there's
it's not
overflow.
It's more than enough, ina flow tu. Na kuna yule mwenye anajaribu, unamuona mpaka anakamua kabisa. Can they feed the same?
Yes. Mwenye kusema tosha ni huyu.
Okay.
Mwenye kusema tosha ni huyu. Mwenye nataka mingi bado ni yeye. So if it is excess, feed the baby first. Wacha hashibe, yeye alale. If you feel like it is too much, you know, hatuna place ya kudonate. That's why there are others who are donating milk, but I think our Kenyan system has not yet gotten there. There's one in Pumwani, but they only allow within Pumwani because I think, you know, it has to be checked and done what. So system yetu bado ijaenda huko. Hao ndio tunawaambia, you know what, donate. So that to continually also keep the supply. And then wale wako kidogo, we encourage that, you know, bring this baby more frequently into the breast, because what we want to do is we want to signal this brain that whatever we have is not enough. We want to make more. This baby needs more. So the more you bring the baby, if it was a 3-hourly, we now bring you to a 2-hourly window and make sure that you are getting enough for the baby. Ni demand the supply, tunacheza hapo.
Is there nutrition for probably the mother to ensure this flow of milk?
Actually, hiyo ndo imefanya wamama wengi pia wanakataa kunyonyesha. Flask ya chai, flask ya uji, flask ya
supu.
Masupu umekewa yote, njahe, sijui ma cookies. Mtu wako, mi sitaki kunona, so wacha nisi breastfeed. Aya, here is your word for you. Just eat a meal for one. A meal for you.
Yeah.
And then drink double for the baby. Yes. So eat your balanced diet, normal, if it is 3 times, 4 times in a day, that is okay. Balanced for the mother. So it is the mother who is feeding. And then hizo maflask, machai, manine, you know, you don't need it all. Just drink for 2.
So njahe should not be double.
So njahe should not be
when
double.
You're breastfeeding.
Eka njahe kidogo, mchele yako, maboga. Kama ni fruit, kula vizuri as a mother.
Yeah.
Because breastfeeding importance tulisahau moja pia, you know, it helps a mother shed weight.
Yes.
Excess calories that you're building during pregnancy, mtoto anafaa kusaidia kushed daily, you're shedding calories. So imagine ma flask manini, you are packing on the calories zenye zinafaa kwa zimeenda. Yes.
But I think also it is with the, probably let's say the African culture, we are cultured into almost lazima. Ananionyesha, mpakie.
It is our society. It is our society.
Eat for 2.
Now we know.
From the time you're pregnant all the way to delivery to breastfeeding, eat for 2. Eat for 2.
So if
We
you have
wanna
this,
see
if
it.
you have this mother who is the milk is not enough, so what are some of the issues we can address to make sure the baby gets enough? You've tried everything, you've tried doing the 2 hours, but it's still not enough. Baby is not increasing in weight. Are there things we can do to increase the milk?
For the milk after, this is the baby that needs to drive that supply.
Yes.
So if we are not achieving, that is where now we will call on supplementing.
Okay.
But we will supplement in a certain way. We don't need to supplement continually without latching this baby. We need to latch so that we also understand how much does the baby want. So we estimate it by adding up. So we back up whatever the baby has emptied. Now we do an additional of supplementation. And that will be formula. Now that we do not have, stored milk. And this mother actually does not even have excess milk because we cannot say there is more in the store. Hakuna. Yes. Aiko. We call shots for supplementation formula. Yeah.
But you also need to look at other factors. I think he had mentioned it. Stress can actually cut your milk.
Okay.
Because the when the baby is breastfeeding, it's communication between the brain and the breast and the baby. Brain, breast, and the baby. So anything that affects your brain might affect the milk.
Yeah.
So the mother needs to be prepared even before the delivery. So if the mother doesn't get enough sleep, if the mother is stressed, maybe the social setting, there are those mothers who are depressed, maternal blues, maternal depression, the milk can. So that has to be addressed before delivery and even after delivery. Now, in terms of the mode of delivery, we've seen that mothers who are operated cesarean section, they take time to actually get enough milk for the baby for obvious reason. For normal labor, there's the oxytocin hormone, which she's been mentioning. So during labor, you have that hormone in high levels. So when you deliver, it will be easy and faster to breastfeed and also form the milk. But for the CS mothers, there's that bit of, there's no labor. Then we have pain that comes after the delivery. That is enough stress for the mother. And now the position, the latching, and sometimes even the social setup. Everyone is trying to tell you everything. I'm sure you've had that experience. Everyone is a teacher and you're the only one who doesn't know. So you keep on blaming yourself that I'm the one who is not breastfeeding the baby.
Because the experience.
So you have to address all that. And if all fails, there are some drugs we can actually give. Yes, to supplement now there. Not really supplement, to stimulate
the milk.
The milk. Yes. So there's that point you can reach and you have to give drugs for the mother. And there are those cases that there's nothing more you can do. And you just have to give the formula throughout. Yes. So you do breast milk and the formula. But we shall advise anytime the baby is hungry, you start with the breast milk. In case the baby doesn't get enough, now you add the formula and not the other way around.
Not the formula and then breast.
Yes, not the formula then breast.
It is breast then formula.
Okay. You've mentioned about pain, and there are those who experience pain while breastfeeding. Is it normal? How do we prevent it? Tell me about it, because there's pain.
Yes.
Saa zingine.
A painful breastfeeding is not normal.
Okay.
Yes. Like we said, clutch. If this baby doesn't get the nipple correctly, then they are thinning on the nipples and these nerves are sending what? They are sending impulse to the brain and indicating that the brain, the breast has an issue. So you need to break that latch if it is a poor latch. Another pain is maybe the mother is very engorged. You know, a very full breast, it is swollen than the abnormal. You will feel it very tender and soft and maybe warm when you touch it. Sometimes even the baby will be able to refuse to feed on it, you know, because of the pressure. So you have, that is when now we call it an engorged breast. Yeah. And this engorgement, if it is not treated earlier, because what you need to do is you need to release the pressure. So you can still feed the baby, but you can attach the baby later. So how do we treat this engorgement? Because if we don't treat the engorgement is when we now get to an abscess and mastitis, where sometimes it's complicated. You go for surgical.
Okay.
Yeah. So engorgement of breast, actually there's a secret. You could just use a cabbage leaf. Cabbage leaf is an antioxidant. So you take the cabbage leaf, you wash it nicely, you put it in the freezer. So let it harden a bit, and then now you place it on the engorged breast. So what it does is, you know, the cabbage always blanches, ile kusweat kidogo, you take it off. So what it does is it releases more fluids from this fullness of the breast. And you don't want to do it more than 20 minutes. And you don't want to do it more than 3 times, because what it does, it also cuts on the supply. Yes, so you need to be careful also when you're using the cabbage leaves on the engorged breast. You can also, what you need to do is before you feed, you could just do a warm massage, maybe a towel you place on it, so that it helps to just relieve the pain, numb it, and also be able to melt this milk down for the baby to feed. With even an engorged breast, we need to make sure that this baby is feeding. But what we want to improve is this brain of the mother, you know, relieving this pain and discomfort that she has. Yeah.
So, you mentioned about the mastitis and the breast engorgement. Do we have other serious, okay, they can be serious, they can fail to be serious, but do we have other conditions that come with breastfeeding? Aside from the mastitis and the breast engorgement, are there other conditions that come with breastfeeding?
Now, maybe I should expound on the mastitis, because it's actually infection as a whole. And hygiene is very important. How you latch the baby, how you breastfeed the baby. So if you have pain that is not resolving, sometimes you might think it's just engorgement, and yet you already have an infection. So if you feel your breast is tender, you have some fevers, maybe a headache, you're not feeling well as the way you'd feel. So it could be mastitis. And mastitis is just a general infection of the breast. Now, the worst that can happen is forming pus in the breast. We call that a breast abscess. So for mastitis, we just give you antibiotics. She's mentioned about the warm compression before breastfeeding. And sometimes also after breastfeeding, you can soothe the breast using a cold compression. So warm compression before you breastfeed, then you do a cold compression after. Yes. Now, for an abscess, that is now the worst that can happen. Because once you have pus, you have to go and drain it. It's actually a surgical procedure. And sometimes you might even advise you not to. Actually, most of the time, if you confirm it's an abscess, we'll tell you not to breastfeed on that side. So you just express and you discard. You express and you discard. So that you don't have milk building up. Because milk building up also is a risk of getting an infection. Now, rarely, it's been reported, but rarely do you get women who have cancer and at the same time they are breastfeeding. So some signs that can tell you that is sometimes you have pain, you might see blood in milk, that is persisting. If it happens once or twice, there's what we call rusty pipe syndrome, where you can have some pink or brown discharge on the milk. If it's temporary, that's okay for a few days. But if it keeps on recurring, you have to go see your doctor. They might want to do extra tests, maybe do a scan or some blood test to make sure nothing serious is happening. Or if you notice there's a lump, of course, when you notice there's a lump, you have to go.
You're very alert.
Yes, you have to go to your doctor. So there are those telltale signs that might tell you something is not right. Yes.
You mentioned the infection.
Yes.
Does it happen inward or is it outward? Is it something you can look and see, I have an infection? Is it inward?
It's most of the time it's inside. Yes. So, but you will see the sign from the outside. Just like when you have an infection on the skin or you have pus on the skin, or what we commonly call a jip. Yes, there's a lot of pain and you don't even want to touch that place. So the skin might appear red, might be swollen. It's tender to touch. If the baby tries to breastfeed, it's like it's war. So those are the telltale signs. So most of the time it's inside and not on the skin. Yes.
And we've seen now on the matches with the babies and back to the mother. Ninanyonyesha, niko na uchungu kwa matiti. Tumetreat your matiti. I'm having cramps.
Mm-hmm.
Is it normal? Is it abnormal?
Cramps are very stressing, both to the mother and also to the nurse and the doctor sometimes. Because now you've been in labor, you've delivered,
Kabisa.
then you feel like you're in labor again. So now what usually happens when you breastfeed and also after delivery, there's that hormone we've kept on referring to. It's called oxytocin hormone. Sometimes it's called the love hormone. Yes. Now,
love.
yes. Now, when oxytocin is high, it contracts the uterus. Yes. That's why after delivery, and when you're breastfeeding, you get those cramps because of the high oxytocin levels. And the same hormone, together with another hormone called prolactin, they're usually at high levels when you're breastfeeding. So when you're breastfeeding is when you feel very severe cramps. For some people, it's very mild. They might not even notice it. In a way, it's also medically good to have those cramps, because that's when now you release the lochia. Because when you have the cramps, you'll feel like the blood is coming out. But within a few days, the pain will subside. And you'll get used to it. It's one of the reasons actually we give analgesics or painkillers after delivery. So it's manageable. So you should not be told severe cramps is normal after delivery. No. Because what we don't want is you having a lot of pain, then you stop breastfeeding. So the cramps they're normal. Yes.
Oh, okay. So I was beginning to add. Wanasema kumaliza labor, that is it.
That is it.
Kwani bado tunaendelea?
Yes. The first few days is a bit stressful, but with the time it will clear. Yes.
I remember we said the uterus was stretched, holding this baby. So those cramps, it's like now returning the uterus back to its size. Yeah.
Yes.
And it's even helping with.
You're like, I don't think so.
No, it's true. It's true. Yes.
Now you know, uterus is shrinking back. But you'll still be given some medication.
And another thing, if a mother is reassured knowing that this cramp is normal to experience, also the pain score drops because now you are aware. You're not worried.
Psychologically.
You're prepared psychologically.
Okay. Because first time kimaliza labda tu
ndio hivyo.
Na ukikimbia Google inaenda kukushtua.
my friend. It's not normal. So now when we go back to the baby amenyonya, amemaliza, and they're crying.
Mhm. So before you start to feed, like I said, you treat this baby just like yourself. Yeah. So with every waking, you want to just check their diaper for their comfort. Because amelala, a very well fed baby kwa wale wenye wako na frequency of pooping, they will poop on this every 3 hours.
Okay.
Because they've had enough, they are full, and we said it's easily digestible. So utapata wamejiwet, wako na poop. So just try to change them. Sometimes it is gas. With every feed, mtoto anameza hewa, especially with poor latch. So what you want to do is you want to make sure you are babbing them after every feed. Hiyo hewa escape, a colicky tummy and uncomfortable baby, of course, atakuwa cranky. Okay? So check the diaper, make sure the baby is babbed well. Another thing, release the gas. Just play with the baby, massage your baby gently, even on the arms and what. Just release the tension. You can always do a bicycle ride on them. Usiogope, nini zao zinakwanga very flexible. Ndio sana unapatanga hata mtoto amelala amejikunja hivi, unashangaa what is happening. So just try to release that tension on them. Yes. Another thing, of course, kuna hiyo kuangalia jaundice. Kuangalia mtoto kama ako na fever. So you want to rule out that after you have ascertained that this baby maybe is not uncomfortable, gas, nini, you also need to rule out kama mtoto ni mgonjwa. Or you've even overdressed them. Sometimes
the environment.
Tunaanza kusema chukua mtoto amelia. And actually wewe mwenyewe una sweat, mtoto amevaa jacket
na mboshori
na kwa Mombasa. Pia mtoto unajua ana itch. Anataka pia kurelax. Mfunike baridi naingia. Yeah, so miguu na kichwa most of the time is where it will tell you to cover the baby, because this is where they tend to lose a lot of heat. So in your Mombasa and it's very hot, just cover their head na huku. And sometimes they can have a vest or even a diaper only if your environment is warm. So wanasemanga whatever you have, dress the baby, maybe just something small extra.
Wale waku overdress. You have been addressed. I think also, as you say, depending on your environment.
Yes,
So as you are, so the baby. Up to. Yeah. Then tukiangalia tukisonga. Ndogo mawazo zimepotea.
Umekuwa excited na overdressing.
Hiyo utapata ni personal experience.
Mbalishe.
Nimemguza.
Actually, it's opposite. Ametoka kwa environment ya joto, kwa hivyo mbalishe.
Ongezea.
An empowered mother, by the way, knows better. As a mother, because like you said, we are surrounded.
Yeah.
We are surrounded by society noises. But as a mother, if you know better, you know the correct choices to make for your baby. Yes, as much as unaambiwa, load. That is their mindset. But what do you know as a mom? Because you're the main advocate for your own baby.
It is.
Wewe ndio mtetezi, wewe ndio unamfeel.
Now, when a mother is sick, can they still breastfeed?
Yes, but sometimes it depends on the situation. You can say a mother who's sick and in ICU is still able to breastfeed. No, that is when maybe supplementation will come. But there are also medications that doctors will prescribe to a sick mother and they are not allowed to breastfeed because those medications cross the milk barrier into the baby. So ikiingia kwa breast milk, you are not allowed at some point to breastfeed. So your doctor, even if your doctor does not know your history, maybe you've come to Dr. Karanja, is your gyna, anajua umejifungua. But now you're going to another GP somewhere or another doctor somewhere who does not know that you have a breastfeeding baby. So always let the doctor know that I'm breastfeeding, so that they can recommend you the exact medications that is safe for a mother who is breastfeeding. And if they do not have an alternative and you have to you have to take the exact medication and the baby is not to be fed, then you can supplement. Your doctor will guide you on the same. But most of the time they'll give you an alternative. And rare cases is where you have to stick on some medications. Yeah.
Because I've noticed the medications was very restricted.
Yes, not for pregnant.
Not for
mothers. Mtu anaendelea tu ni kujitetea.
Sasa mwambie daktari tu. Information is important, as they say. That's why every sitting with a doctor ni consultation, and part of it is a lot of questions.
Yeah.
It's a lot of questions to get information, which is history taking, which is important to mention your part.
Yeah.
I'm pregnant, because the doctor is going to recommend you dawa na hajui.
Yeah.
Maybe sometimes unajua labda ametoka kuona male patients. Amesahau hiyo part ya kuuliza, are you expectant? You know, we are humans. Sometimes haezi scan hivi aone uko pregnant. Wewe sasa ndio unajua your menak. But most of the time, you know, they will ask, when did you last have had your menses? Sasa you'll also find unaenda a doctor's visit, unaumwa na kichwa yenye imekuwa persistent, unatoka hapo umeambiwa you are expectant. Because why part of the history taking ilionyesha you missed your menses like maybe 2 months ago.
Yeah.
So it's important to give information.
That is good. You mentioned about bathing. Making sure the child is bath. Are there different positions to bath the baby? Or is this just one particular? Ananyonya alafu at what frequency should I bath the baby? Akimaliza kunyonya ama akiendelea kunyonya anabab, tunaendelea. How do I bath the baby?
So babbing a baby lazima uweke on a flat surface.
Okay.
Of which says ekelea hapa kuna nyonyoka bump, you know. So most of the time the mothers will prefer like just above the breast, they'll put the baby there.
Okay.
Sometimes wanasema on the father's chest. But kama hayuko, itabidi ukuje hapa kwa mguu. So on a flat surface. So kubab ni mtoto atoe hiyo hewa yenye amemeza. So most of the time like I said, you will come to understand your baby, how they behave.
Yeah.
Ukiona ako uncomfortable, utambab. Ukimrudisha kwa matiti, ataendelea kunyonya. And I told you the transition ya milk. So kama hii matiti haijakuwa empty, take the baby back to that same breast so that aendelee kupata hizo calories. And I told you it comes later. The main food is yet to come. So mrudisha hapo apate sasa the main meal. Your next feed utamweka kwa the other breast. So you will learn that with your baby, knowing your baby amekuwa full ama bado. Because kama hatataka matiti ya utamrudisha hapo kumasha ame have enough. So just bab or use your leg. Sometimes kama hawezi mguu, you know, on a pillow or a flat surface too, with the head on the side. Because sikose pumzi. And another thing pia, the lining of, you know, sometimes their sphincter, they don't close.
Yeah.
Very often inabaki wazi. That's why unapata watoto wana belch. So they could choke. because is it swallowing reflex?
Mm.
Yeah, their swallowing reflex
Aspirate,
is not as, so they could aspirate. So make sure your baby, that's why we advise babies to be,
On the side.
you put them on the side or you tilt them on a very slight pillow.
Yeah.
So that is idea your swallowing and regurgitation. Yeah, affect your aspirations. Yeah.
Because I think bapping does they get very uncomfortable and very uneasy. It's not back. I mean, I'm trying to imagine mimi mtu mzima pia saa nyingine
Ukiwa bloated.
you're trying to just
Na
your position so that you talk and I don't.
You tell your man to bap you.
Ati you tell your man to bab you.
Daktari alisema.
Then now amenyonya, tumeendelea, tumeanza weaning. Nimwatishe matiti immediately ama for how long? Aendelee. For how long should my baby breastfeed?
Exclusive is 6 months.
Yes.
6 months because studies shows, uzito ya maziwa ya mama after 6 months, and also whatever the baby receives as calories is not as strong as before. So that is why we are introducing meals. Okay. So we are introducing meals to supplement the calories that we are still giving through breast milk, that it is not enough. But we are not stopping breastfeeding. Okay. So that is why you are told when you are starting to wean babies. So if you've started maybe like over lunchtime, you are already feeding. So you're feeding maybe 8, you're feeding 11, and then you're supposed to be feeding at 2. So you decide, like 2 is when you're giving food. You don't breastfeed at that moment. But these other ones, you continually, as you progress, replacing, but you have to give the baby what? Breast milk.
For breast milk, iachishwe at 6 months.
Iachishwe at 6 months, na iachishwe mpaka at least mtoto ako 2 years. Then from there now, there are families who wants to have another baby. You can stop at 2 years to get another baby. Aya, maybe mama anataka tu, unajua tosha. Wewe yako imeisha at least 2 years. Unajua kila mtu ako independent. So that is when we can actually say, but if you still want to breastfeed even 5 years, you are allowed.
Okay.
Yeah, as long as you are comfortable, the baby can still come to your breast.
You're breastfeeding.
5 years too.
Because pia mtoto mwingine next anaweza kusurprise. Akwambia sitaki hiyo matiti at 9 months.
Yeah. It happens.
Yes. It happens, but rarely do you find mtu at less than 6 months akikwambia anyonyi tena. Rarely.
When it comes to your breastfeeding, then you realize you're pregnant. Niatishe maziwa ama niendelee na kunyonyesha?
Endelea na kunyonyesha.
Irrespective of the time.
Now, what we shall advise in the first, second trimester, it's been shown to be safe. You don't have to stop immediately. But around 24 to 26 weeks, it's advisable to stop. You'll even be uncomfortable.
Yeah.
Having a big, and then you're breastfeeding. Yes. And also the baby's kicks. This child is growing, and you also. I didn't say that. And there's the issue of oxytocin.
Yeah.
Oxytocin can cause contractions. So you want to avoid early labor. So when you're nearing the 3rd trimester, we advise you can stop. But there are some mothers who breastfed up to the 3rd trimester. Yeah, but we don't advise. Yes.
At least first trimester, second trimester is safe.
Yes.
Okay.
Maybe something she needs to clarify is, you mentioned exclusive breastfeeding. We assume everyone knows what
exclusive.
Yes. Kindly clarify on that. Some will give water, some will give. Yeah.
Exclusive breastfeeding is breast milk only. No water, no nothing for 6 months. And also for babies who use formula, after we have ruled everything out, that this is a baby maybe who cannot breastfeed. You know, we are still doing exclusive breastfeeding of the same formula with no water. Yeah, even you see, you're introducing even water. Like I said, you clock at 2 p.m. to start weaning that baby. Maybe the thing you're weaning is not even food. You're now starting with water. So you're giving this baby water, and you're not giving a whole 2 liters of water. No, we are giving like 20 mils of water. And then you now even give the same 20 mils of feed, of maybe plain something. That is how you start introducing. So exclusive breastfeeding. Si kupatia mtoto uji hapa katikati ati juu hajashiba.
Kama na mimi anasikia kiu. Patie maji.
Breast milk is a whole meal. It's a whole meal for this baby. Exclusively for 6 months.
6.
Hiyo ndo chakula pekee. Yeah.
Hata glucose asipati. Hata machungwa.
You know, we want to achieve that because study has shown actually, I know within everyone's environment, if you find a baby who's been exclusively fed, that baby has never stepped into a hospital with these small illnesses. Yes. As much as we are giving them vaccines, breast milk is also an immunization, like we said, with the antioxidants and the immune building immunoglobulins that is found in milk. And that is a natural remedy. It is from the mom to the baby. So let's give our babies a chance to fight their immunity and build it by breastfeeding.
Give that baby a chance.
6 months. Peke yake. Na kuna 2 years na 5 years pia.
Changanya zote.
Yes.
So we have babies who refuse to breastfeed. Yeah, kata unampatia, you've done all you can na amekata. How do we handle such babies? Hajamaliza 6 months lakini amekata. Ukimpatia titi anaangalia the other way. How do you handle such a baby?
So we need to rule out the cause first. So this baby has been feeding. Why all of a sudden this baby has refused to feed? So after we rule out, maybe the issue is maybe the baby has an infection in the mouth. Maybe the mother is having too much or excess sometimes. Okay, maybe the baby is also unwell. That baby is not able to. Or even it's an overstimulated baby. You know, too much noise, shaking, not in a quiet environment. Like Dr. spoke about the chain of brain, baby, and brain, breast, baby. So you have to rule out the environment. You have to rule out on the baby positioning. You have to rule out on the breast itself, like the nipples. Maybe they are clogged ducts. Like alikuwa amesema there is rusty, you know. So unapata labda mama kona blockage, mtoto hapati maziwa, anakuwa overstressed, yeah. So we need to rule out all that why is this baby not able to breastfeed. Ama all of a sudden, you know, ameacha kunyonya matiti moja na prefer ingine. I've found such cases. So you have to sit down and as a lactation specialist now you come in and explore all that. Maybe if it is beyond what we can do is this baby the mother has to just now express and try bottle. Because sometimes another reason is maybe you want to sleep at night, you have been expressing, and then you're giving the dad to feed the baby at night. So most of the cause of if you start a baby on bottle feeding is the teeth that you're using. If the teeth is ejecting a lot of milk, mtoto si pia yeye amezoea starehe. Mbona aende mdomo yake kuvuta na kuna mahali inaweza pata easily na mwagika tu, inatoka tu. So the teeth as also we use, if we are giving the baby a bit of struggle to mimic the suckling, it is better because they can easily come back. Lakini kama anaipata rahisi, mama sasa utabaki kipamp. Jipange. Atakunywa na chupa. So we need to understand that because most of the time there is something that has interrupted that chain that has made the baby refuse. So we need to explore on all that.
Wow. That was us with breastfeeding. Please give us all your questions. Any question that you feel you've not covered in breastfeeding, tuulize, tutawajibu. Daktari atajibu, mimi nitauliza. And Oakland will answer you. So give us your questions, we will answer you. We're here for you. Asanteni sana. Please, you can tell us unapatikana wapi. Maybe kuna yule ameangalia yako like nataka nikutembelee. Unapatikana wapi?
Kwanza niko Mombasa. First and foremost niko Mombasa. But I'm also open virtually, where you can support a mother virtually. And if it is something that is very complicated and I'm not able to help you virtually, I can try and look for a team from the same lactation to support you where you are and next to you. Because sometimes, we need to be there to also explore and see. We'll share my contacts on the screen. You're able to get them and just give me a call. Leave me a text. I'm the mother of so and so, this weight, how old is your baby, and your concern, and then I'll be able to schedule as a call. For those in Mombasa, I'm available at Modern Clinic next to Dr. Karanja. For those who are not able to cross to this side out of town, you'll find me at Modern Clinic. And for those who are on this other side and are not able to access town in Mombasa, I'm at Epic Business Park, second floor at Mombasa Laparoscopic. So just make an appointment with me and then we'll see where between in town and this other side where we'll be able to meet and make sure that we are enjoying breastfeeding. And work with you in your support. Kabisa. 5 years, 10 years.
Dr. Karanja, tunajua pale tunampata.
Yes. Maeneo sijabadilisha. But just a message to the mothers and also to gynecologists that breastfeeding is as important as the pregnancy journey.
Yes.
And the labor. We discuss with mothers a lot about pregnancy, about labor, but sometimes we forget breastfeeding. So that's why we have a team now of lactation specialists. Lactation is just breastfeeding. So you can come, you can get counseled, advised on how to do it best before labor and after delivery, so that you're prepared psychologically and you know what you're expecting, so that we avoid these last minute surprises. You think you've finished the journey of pregnancy, now you're starting another stressful journey. So you'll find me at Modern Gyno Clinic, Dr. Karanja, who will share our contacts and our social media pages. Continue asking us questions at Ask Your Gyno, Modern Gyno Clinic. Karibuni sana.
Asanteni sana. Until next time, we are your guys. Ask Your Gyno.